The Sunday Business Page is brought to you by Fregasso Financial Advisors. We guide for life.
Good morning, I'm John Delano. Welcome to the Sunday Business Page. This morning, the political and medical fallout over the lack of vaccinations for thousands of children and adults to prevent the spread of communicable diseases like measles, mumps, the flu, and polio. Johns Hopkins University's Dr. Amish Adalja will share his thoughts with us. Then the continuing controversy over whether and what kind of billboard should be permitted on Mount Washington promoting a business. Lamar Advertising's attorney Jonathan Kamen will present that company's point of view. And Fregasso Financial Advisors Bob Fregasso has some very important advice about retirement. It's all next right here on the Sunday Business Page.
This is the Sunday Business Page on KDKA-TV.
And a very good morning to you. Thanks for spending part of your Sunday morning with us. This past week, the National Institute of Allergy and Infectious Diseases warned that a rare, mysterious type of paralyzing illness, acute flaccid myelitis, or AFM, could become an even bigger threat in the United States. The disease, which has some similarities to polio, is affecting more and more children. And it leads to a much larger question about whether the failure to vaccinate millions of children is threatening the world's public health. We welcome Dr. Amish Adalja to the Sunday Business Page. Based in Western Pennsylvania, he is senior scholar at Johns Hopkins University Center for Health Security and is an expert in infectious diseases and pandemics. And doctor, you're the man we always go to when we have questions about healthcare and infectious diseases. And let me just ask you, Amish, this whole anti-vaccination movement, it's taking a toll because it means more and more children are left unvaccinated. Is that right?
Right. This is something that I call the return to the primitive, because civilization has really been this progress against communicable infectious diseases almost entirely aided by vaccines, where children are not dying in childhood, where diseases that once were very common are very uncommon. And now what the anti-vaccine movement threatens is to actually pull us back to that era where you have measles outbreaks, mumps outbreaks all over the country. And I think that that's something that we can't really tolerate and something that has to be identified as a threat to public health.
We are seeing more of these outbreaks. Did I just read about a measles outbreak?
There's a lot of measles outbreaks going around all over the country. There's about 400 cases that have occurred already this year, and we're only in April. Big outbreaks in the Pacific Northwest, Michigan, Rockland County, New York has a major emergency right now where if you're not vaccinated, you're not allowed to be out in public. So this is something that's completely preventable. It's a self-inflicted wound that has really been brought about by distrust in vaccines.
Let me ask you about, there might be a common belief out there that, well, if 80% of us are vaccinated, then there's no problem. But there is a problem, right?
Right. It depends on how contagious the disease is. So 80% is nothing for the measles virus. The measles virus is one of the most contagious infectious diseases known to man. And you need to have population levels above 95%.
95% of us have to be immunized for all of us to be protected.
Right. Measles is so contagious that one person can spread it to very, very many people. And if there is an unvaccinated person, the virus will find that person. That's what we talk when we talk about herd immunity. That's what we're talking about. For measles, the herd immunity has to be very high to keep it at bay. And you have to remember that some people are too young to be vaccinated for measles. We start vaccinating around 12 to 15 months. And there's some people that are too sick, have another illness that doesn't allow them to be vaccinated, and they're protected by that herd. So there's lots of issues with measles.
Well, let me ask you about public health policy, essentially laws in states, rules that require children to be vaccinated before they go to school, for example. It's a state-by-state thing. Maybe that's a mistake to begin with because we all cross state borders. It's not a national policy, but we have state laws that dictate whether we get vaccinated or not. Is that the way it works?
Right. So school districts are able to set their vaccination policy at the state level. So each school has the ability to say what are their entry requirements going to be. And what the issue is many states have big loopholes, what are called philosophical and religious exemptions that are exploited by people who don't want to get vaccines.
Well, let me stop you right there, Amish. Is there any religion that you know of that opposes vaccinating children?
No, I do not know of any religion.
None whatsoever?
No.
So why do we have a religious exemption? It's like a loophole.
Right, I think that
anybody just claims it and there you go.
Yeah, it gets exploited. So, for example, in certain places, you can find people creating their own religion in order to not have to get the vaccine. It's just a way for people to avoid the vaccination.
So the only reason to have an exemption for a vaccine is that it could cause that there's a medical reason. Is that a valid reason? There are some, I assume.
Yeah, there definitely are certain people who cannot be vaccinated. And there's only 3 states that actually have that as their only exemption: West Virginia, Mississippi, and California.
So stop. West Virginia has tougher rules with respect to vaccination than the Commonwealth of Pennsylvania?
It does, yes.
That's going to surprise a lot of folks who may think a little less of our neighbor to the south. But the fact is, the only way you can avoid a vaccine in West Virginia is if a doctor says that you cannot vaccinate this child, it'll cause more harm than good?
Right.
It's amazing. And California, you mentioned California, which is 1 out of 8 Americans lives in California. That's a state where usually you think anything goes, but they have a very tough rule with respect to vaccinations.
Right. They got hit with a major measles outbreak in 2014 that was centered on Disneyland, and it really got policymakers there thinking that this was a danger to their state, and they tightened their school entry requirements. And we've seen measles cases go down in general of people that are not vaccinated there, but they really took it seriously. But it was a reactive type of thing. What we need is proactive changes to these laws so that we don't have this kind of tinderbox all over the United States where these vaccine preventable outbreaks can occur.
Well, you're prompting me to ask some of our state lawmakers about this because I have no idea. Are there efforts going on in Pennsylvania to tighten the giant loopholes we have in this state that allow families to avoid vaccination?
There is a bill right now in the Senate, I think introduced by Senator Leach, that's trying to change some of those. But these things don't go very far, and the anti-vaccine movement will turn out in droves in Harrisburg and shout down anybody that wants to tighten our vaccine school entry requirements.
Let me ask you about, is it AFM? Is this a big problem here in Pennsylvania yet?
We've had cases of AFM last year at Children's Hospital that were investigated. So AFM is a polio-like illness likely caused by a respiratory virus that leads to this reaction where people can become paralyzed. It's a very scary type of illness, and many people don't fully recover. And we don't know all the answers, and that mystery kind of adds to the panic around it. And the CDC is working diligently to try and understand the causes.
Does the polio vaccine work against this, or do we have to come up with a new vaccine?
We do need a new vaccine for this. It's likely a virus related to polio, but not the same as polio. And there are efforts to make vaccines against this family of viruses, but we still have a lot to learn about AFM.
So the bottom line with all of this is that if we want to protect our children, we need 95% of us vaccinated, and that means we've got to talk to our lawmakers in Harrisburg and change the state law. Bottom line?
Yes.
Bottom line. Dr. Amish Adalja, great to have you on the show as always. You're such a wealth of information. Thank you, sir, very much for joining us. Next on the Sunday Business Page, the continuing saga of one billboard inside Pittsburgh, Pennsylvania, and atop Mount Washington. Attorney Jonathan Kamen, representing Lamar Advertising, will join us. Stick with us.
The Sunday Business Page will be back in just a moment.